My name is Greg Bantick. I've been practicing traditional Chinese medicine for over 40 years and have been involved in a variety of senior academic positions in colleges here and in the United States. I'm a proud team member of the Health and Healing Wellness Centre. Traditional Chinese medicine is the indigenous medicine of China, has a written history of a bit over 2,000 years, probably an oral history a long time before then. China was a very sophisticated and technologically developed country, even in its earliest days. And out of that, of course, came a very sophisticated and refined medicine, which has continued until today. And in more recent years, it's been growing in popularity throughout the West. When we're using acupuncture, we've first come to a diagnosis and then decided on some principles of treatment, and they kind of guide the choice and selection of points. Often the sequence of needling, even whether we do both sides or just one side of the body, and then we carry out the treatment. And selection of points is not always just using points locally, but also using points that are known for, because of their qualities or because of accumulated experience, we know that they affect areas at a distance to themselves. So, for example, we often use points on the feet for headaches. Seems a little unusual perhaps, but this is based on logical and consistent and reproducible thinking about what is the nature of these points and what sort of influence do they have on the body. But we also use massage, we use moxibustion, which is the warming a point with burning Artemisia vulgaris, usually termed moxa. We also can stimulate points by tapping on them or using cupping, vacuum cupping, and many different ways of using other forms of heat, many bathing, poultices, herbal compresses, many different ways of stimulating points. As well as acupuncture, one of the main things that I utilize a lot is herbal medicine. And traditional Chinese herbal medicine is quite different than Western herbal medicine. We use formulas, groups of herbs that are quite intricately and sophisticatedly worked out to help with a wide variety of conditions. One of my main areas of interest is in skin disorders. So we see a number of people with very painful and often distressing conditions like psoriasis and eczema, dermatomyositis, and another area of interest is helping people with various mood disorders, anxiety, panic attacks, depression. These are seem to be becoming more common. Also, as a general practitioner, you see a lot of folks with sleeping problems, or women with menstrual problems, or fertility related concerns, digestive disorders, of which there also seems to be an increasing number of patients with presenting with digestive disorders. So we see a wide variety of people. Most people have acupuncture and herbs, some people just one or the other. Together we try to work out what is a good treatment protocol, and then also try to offer, if there's some dietary suggestions that may be helpful or some exercise suggestions. All of this is part of Chinese medicine. So we try to give general lifestyle advice as well as administer treatments. Seeing people improve and become much more comfortable, say with, for example, a very painful and distressing condition like psoriasis, that they feel better, that we see the skin improve. And so it's very rewarding to be able to do a job and to help people, and to be able to help people with quite a gentle form of medicine. A very satisfying thing and rather a privilege of being a practitioner is getting to share and hear some of the stories of people's lives and getting to know their family members, their partners, and so on, and sharing in people's lives is enormously rewarding.